So you come to the ER because you have these symptoms. You're peeing all the time, you're thirsty, you're super tired, you're nauseous maybe, you're losing or gaining a bunch of weight, whatever. We get blood work, we get a hemoglobin A1C, and it's 15. Uh-oh. Or let's say you're in a shop that doesn't really do A1Cs. We check your sugar, it's 500. Uh-oh. You're diabetic. You need to say the word diabetic. You have diabetes. Like a lot of things in emergency medicine and medicine, you got to say the word. Like if people pass away, you don't say they're in a better place. You say they died. You need to be respectful, but blunt and direct. That's how people understand what you're saying. But the tone of how you say it is very important, right? Like if their A1C is now like 7.5 and they're like a little bit diabetic and they've been on metformin for a while, and obviously that's not working. Their A1C is going up, and this is already something that they were kind of aware of. You got to take them where they're at. If they are coming off the street with, I have no medical problems, nothing is wrong with me, I thought I had appendicitis, but surprise, it's diabetes with an A1C of 15, you got to meet them where they're at. That's totally out of left field for them. And in these situations, there are three things that I tend to bring up. One is the urgency of the situation. Two is the necessity for follow-up. But three, and often not mentioned a lot, is the ability for a good portion of these things to be reversed. And it's less about the disease itself being reversed, although for many people with type 2 diabetes that can be diet, lifestyle changes, weight loss, what have you. But even if it ends up being, oh, you are type 1 diabetic, you don't just say, oh, that kind of sucks forever. A lot of these symptoms can be managed. So one, importance of the situation. Hey, if this continues to go unchecked, you're going to feel crummy. People tend to care about that. There is also the heightened risk of cardiovascular disease and stroke and all these other things and weight changes and blah, blah, blah. But in the moment, people care about how they're feeling right now. Be sure to mention that. Number two, importance of follow-up. Hey, you know how like you were in the ER and you had to wait forever and now you have to talk to me in the middle of the night and how this all kind of sucks? You can avoid a lot of this. Here is a follow-up number. There are people who can see you. There are people who can help keep you out of the emergency department and lower your risk of mortality. And three, the possibility of reversal. People want to know what the next step is. Not everyone with a new diagnosis of diabetes is going to be in DKA or HHS or needs to be admitted or go to the ICU on an insulin drip, or they might have a family member that had a diabetic coma, right, and went to the ICU and passed away, right? Not everyone has that. Have the immediate next step. Throughout medical training, a lot of our test questions say like, hey, what is the one next thing you're doing? And oftentimes that's what the patient wants to hear. So be sure you give them that.